Good day, friends. This is Dr. Boppana Venkata Bhargava, consultant urologist, uro-oncologist, minimal invasive surgeon, Narayana R. Tagore hospitals. So today we are here to discuss few commonly asked questions and how to deal or answer those questions. So we suspect there is a lower urinary tract symptoms. So when a middle-aged gentleman with lower urinary tract symptoms are present, so we will evaluate him. First, we'll ask his history in detail. Then we would we'll score his symptoms. So there's something called International Prostate Symptom Score. So we grade the symptoms as mild, moderate, and severe, and we will decide which category he belongs to. Then we will investigate. The basic imaging we use to investigate any lower urinary tract symptom patient is an ultrasound, kidney, ureter, and bladder with 10 post-void residual urine. Then we do an uroflowmetry, an urine routine, and then serum PSA in elderly gentlemen above the age of 50. Once this report comes, we will know the basic idea what problem he has this lower urinary tract symptoms because of. Most common reason in elderly gentlemen with lower urinary tract symptom will be a prostatomegaly. A prostatomegaly can be a benign enlargement of prostate or a cancerous region. If it is a benign enlargement of prostate, based on its symptom score, we will deal it with a medical management or surgical management. If we suspect if there is any cancer in prostate, then the treatment will be based on staging, and staging will depend upon the biopsy and a PS and a PET scan. Young female who comes with burning menstruation and she has taken medications in the past for urinary tract infection. So most probable cause is that she suffers from a recurrent urinary tract infection. So when a young female comes with recurrent urinary tract infection, we have to find out the cause of recurrent urinary tract infection. First, we would take a detailed history of the patient. Then we would subject her to her investigations. The basic series of investigation which you would advise is to do an ultrasound, kidney, ureter, and bladder with a post-void residual urine. We would do an urine routine, an urine culture, a serum create, and we would get back the results. So once we understand if the urine routine and urine culture is sterile or not, then the treatment would be based on that. So if she has an active UTI, and if the cause of UTI is due to any primary reason being a stone or being any other reason, then we should address the primary reason. Like if there is a stone in the kidney which is causing recurrent UTI, then the stone has to be dealt with medical or surgical management. If there's any other cause of recurrent UTI, then the primary cause should be removed so that the recurrent UTI is subsided. Or else, if there is no cause of primary recurrent UTI which is documented, then we should keep her on a low-dose prophylactic antibiotic for a prolonged period, around 3 to 6 months, such that the minimum bacteria which is present in the urinary bladder is completely killed and there is no recurrence of the UTI in the next session. A diabetic patient is coming with a lower urinary tract symptoms, then we should evaluate whether this lower urinary tract symptom is due to a primary cause which is present elsewhere, or is it is the diabetic neuropathy which is causing the bladder problem. So to differentiate this, we shall take a detailed history, then we'll do the investigations, ultrasound KUB, that is kidney, ureter, bladder with post-void residual urine, uroflowmetry, urine routine, urine culture, and serum PSA. Once we know the idea of the basic investigation, if there is a cause of this LUTS is attributed to other reason, that is being a prostate enlargement or stone in the bladder, then that has to be addressed. If not, we suspect a diabetic neuropathy as the cause of lower urinary tract symptoms. So if it is a diabetic neuropathy and if it is causing the lower urinary tract symptoms, we may need to do an urodynamic study to find out how much the diabetes has damaged his or her bladder and treat accordingly. Woman in her 40s who's passing urine very frequently, the most common cause is an overactive bladder. So overactive bladder is a condition in which the bladder contracts very frequently so that even small amounts of urine which is collected in the bladder is pushed outside. So she passes urine very frequently, every 1 to 2 hours. So in the case of overactive bladder, how we diagnose is we rule out the other pathologies which can cause excess urine. So such that the stone or recurrent UTI or other causes. Once these causes are ruled out, then we attribute these symptoms to overactive bladder, and the treatment of overactive bladder will be a medical management. If medical management fails, then we go for something called intra-bladder botulinum toxin injection. So this is how the overactive bladder treatment is. But if any more queries you have regarding urology or uro-oncology, kindly let us know in the comment section. We'll get back to you. Thank you. Stay safe, stay healthy.